And we are learning more about this new variant. Scientists in South Africa, where it was first discovered, are starting to get an idea of how the strain behaves. They also say that they might know how it will affect people who are vaccinated. So for more on this, we want to bring in Dr. Amish Adalja. He's an infectious disease expert and a senior scholar at Johns Hopkins University Bloomberg School of Public Health. Thank you so much for joining us. Okay, so we're getting more of an idea of how this new variant works. There's a few things that we have heard. The symptoms are milder, which is good news, and that the people who, these are for people who are being reinfected or with COVID-19 or for people who are vaccinated. They have milder symptoms. What does that tell you about the variant itself?
It's hard to say for sure because we still have a little bit of a surveillance bias. We don't have a full picture because maybe younger people are just more likely to get infected and then they're more likely to have mild illness. But what I do think it suggests is that possibly even with these mutations and the ability to evade some of the protection from antibodies, that it's sort of evolving to be milder. And sometimes that happens with viruses, that they really are just after transmission. They want to become more efficient at transmitting. It doesn't really matter how sick they make people, just as long as you're sick enough to transmit to other people. And it could be evidence of this virus evolving that way. I think it's too early to say that for sure. I think we want more data to be able to be definitive about that, but it would be a good thing if we see this evolving to become more like some of the other coronaviruses that we deal with year in and year out.
So a scientist in South Africa's infectious disease agency also said that the country is seeing an increase in reinfections from Omicron that we haven't seen with previous variants. Why might that be the case?
Well, when you look at the mutations that are present on the spike protein of Omicron, it does contain some mutations that have been seen in other variants that people have long forgotten, the beta variant, the gamma variant, where we had seen reinfections occur more commonly. So it's likely that these mutations evolved in a way to get around some of the antibodies that people with prior infection had. This is not surprising if you look at the mutations and, like I said, look back at what happened with the beta variant. But usually those cases are mild, which is also a good thing, because what we're really concerned about when it comes to COVID-19 is severe disease, hospitalization, and death. So I think that should be the marker for what level of risk we assign Omicron.
So, as you know, the Biden administration is about to implement all these different restrictions, including asking people who are traveling from outside of this country to the U.S. to get a COVID-19 test within 24 hours of leaving. So when I heard that, I thought, okay, but how sensitive are these tests? What sort of test is it? Because if it's the kind of test that I can get from my local pharmacy, I don't think they're as good as the tests that go to the lab, and I can't get a turnaround in 24 hours for that. Also, I was also under the impression that people who are asymptomatic may not show up on some of these less sensitive tests. So I want to get your take on this idea of getting a test right before you get on the plane, 24 hours before you get on a plane. Is that likely to do anything to slow the spread of this virus?
A test that's done closer to the event that you're trying to test for is always going to be more valuable than one that's older, because you could be in your incubation period. And when it comes to home tests and fast testing, I think it's important to step back and ask, what are you trying to accomplish? What is the question you're asking of the test? And with these people flying and getting the test, you're not asking, do they have minute amounts of virus in their nose? You're asking, are they a danger to others? So for that purpose, I do think rapid tests that you can get at a pharmacy work, because you're not trying to definitively diagnose someone. You're just saying, is this person okay right now? Are they a threat to others? And those tests work really well as a public health test, as a contagiousness test. But what we want to make sure is that this is something that people have access to. It's been very difficult, even with home tests available, to keep them in stock, and you have to drive all around town. You can't have that if people are trying to get on a plane. You've got to make sure that there's more accessibility to these tests and that they have to fall in price.
This week, the CEO of BioNTech, which worked with Pfizer to develop its mRNA vaccine, says that its shot is likely to protect against severe cases of COVID-19 caused by Omicron. But earlier, we heard from Moderna CEO saying, that there's a likelihood that the vaccine may be less effective against this new variant. Both of these vaccines use the same mRNA technology. Why are we hearing two different things from these CEOs?
because they're talking about two different endpoints. So when the BioNTech CEO is talking, he's talking about what really matters: severe disease, hospitalization, and death. And the vaccines are going to hold up against the Omicron variant when it comes to those severe outcomes. What the Moderna CEO is talking about is, are breakthrough infections going to become more common? That's also true, because he's looking at any kind of infection. So I think what's likely going to be the case is that the Omicron variant is going to be able to cause breakthrough infections at a higher rate than Delta and Alpha in the original version of the virus. But severe disease is not going to be likely in someone that's fully vaccinated. So both of them are correct. They're just looking at it from two different angles.
Okay. At the beginning of this whole thing, there was a lot of discussion about masks. Before we were talking vaccines, we were talking masks and washing your hands, and what masks are, the best masks to use. Would you recommend people start wearing those N95 masks, those surgical masks, instead of cloth masks in public? And what other precautions would you recommend people taking?
A lot of this is going to be based upon a person's risk preference, because we know that we can't get the COVID risk down to zero. And we know if you're fully vaccinated, a breakthrough infection is not likely to be severe. So this is sort of dictated by how much risk you want to assume. If you're somebody that's very risk averse, an N95 mask is going to probably be the best type of mask. I don't think this is necessary. I wouldn't recommend it for people to wear in their routine life, but some people will. I think the regular surgical masks with the loops that go around your ears, those are sufficient for most people. That's what I would recommend that people use when they're in high-risk situations. And especially if they're not vaccinated, they should be wearing a mask anytime they're in a high-risk situation.
Sounds good. Dr. Amish Adolja, thank you so much.
Thanks.